On behalf of the Surrey Fire Service, thank you for this opportunity to share some of Surrey Fire Service's initiatives made possible for harnessing the power of data for good. The Surrey Fire Service, which serves a rapidly growing city of just over 500,000 people near Vancouver, uses an evidence-based approach to develop a response to the rising incidence of fire and the opioid crisis. Nearly a decade ago, the Surrey Fire Service adopted an evidence-based approach to its business practices. We adopted the elements of evidence-based decision-making now referenced in the guides, the right decision, evidence-based decision-making for government sector professionals. These core elements are defining the problem, identifying what data is needed, gathering the information, analyzing the results, applying them to a decision, and evaluating the outcomes. Surrey Fire Services in 2007 commissioned the University of the Fraser Valley, Dr. Amanda V. McCormick, to conduct a retrospective study of nearly 5,000 fires over 20 years that occurred in Surrey. The HomeSafe program was conceived to leverage local fire and demographic census data with fire hotspots in the community to target door-to-door firefighter visits and smoke alarm giveaways. This review identified that 75% of fires occurred at residential properties. It was further discovered that only 30% of these fires involved a smoke alarm that was working. The study also revealed that functioning smoke alarms save lives. Fire risk is associated with high-risk people, properties, and places, and that fire prevention home visits and education make a difference. The response? HomeSafe was launched in October 2008. It was further discovered that in spite of more smoke alarms being present, they function less often. Smoke alarms are a primary prevention of fire-related casualties. Risk is reduced by 49% when a working smoke alarm is present. Social data linked from Canadian census tracts in Surrey identified the locations of the top 10% of the at-risk population comprised of persons older than 65 years of age, household members under the age of 6, single parents, unemployed persons, transient occupants, and locations with previous occurrences of fire. This social data was layered and combined, creating linkages that defined target areas. This enabled us to focus our education and prevention activities to the greatest effect. Contacts made by Surrey Fire Services to each residence as part of HomeSafe inspections utilize key indicators across the city demographics. We focused our resources on providing support to seniors and other at-risk residents to target fire risks. The results were 104% increase in working smoke alarms, 63% decrease in fire rate, and 75,000 contacts made. After 75,000 interventions, the occurrence of residential fires plummeted. The incidence of residential fire casualties has dropped by half. In 2014, the results of the treatment seemed to diminish, so we reassessed the social data linkages and retreated the population. There's still room for improvement to increase smoke alarm coverage. Smoke alarms are fundamental to ensuring ongoing reductions in fire-related fatalities. Use of data-driven, targeted interventions can manage risk for individuals, communities, and cities. What if all Canadian fire services adopted this approach?